To give us more insights on this new variant in Philippine shores, we have with us one of DOH technical advisors, Dr. Ong-Lim. Dr. Ong-Lim, this is not the first time, of course, that we've heard the term variant of concern, but at the same time, we're hearing more transmissible. We're also hearing some experts saying that it might get past some vaccines. What are you concerned about? And at the same time, what is there to qualify with the public that has a lot of questions about this variant?
Well, Robbie, certainly the news that's coming out of India is very concerning. We're seeing that they have a really huge surge that they're having difficulty controlling. And of course, the concern is if this variant makes its way to the Philippines, then we might encounter the same situation. But I think the context within which we detected this particular variant is quite encouraging. This was actually detected as part of our routine surveillance. The travelers that came in were subjected to our regular protocols. And when they turned positive, their samples were sent for whole genome sequencing, as is our usual process, which detected the B1617 variant. So for me, that means that our system is working. For as long as we comply with the protocols, then we should be able to, we hope to be able to continue to pick up these variants of concern. Now, dahil itong dalawang travelers naman na to ay na-quarantine natin, at sila ay nag-comply, wala tayong masyadong problems with respect to identifying close contacts. Pero gayon pa man, kung sakasakalit hindi sila na sumailalim ng maigi sa quarantine, for as long as they were compliant with minimum public health standards, di dapat na iwasan din natin yung pagkalat. So you will see that every step of the way, marami tayong mga safeguards. Kailangan na talagang sumunod lahat para kung makalusot man dun sa isang safeguard, meron pa rin nakasalo o nakaabang na pwedeng mag-contain yung pagkalat ng sakit.
But you're talking about safeguards, protocol systems inside the country. What might this variant mean on a policy level, particularly in a question, for example, of travel bans? Should we be looking at an expanded travel ban?
Well, that's being discussed, no? Even as we speak, there are so many considerations that need to come into play for this. If we imagine for these two cases, actually they didn't come from India. They came from elsewhere. No? So parang when we talk about a travel ban, we're not actually just imposing a travel ban on India. These two seafarers, actually their previous, most recent travel was from the Middle East. So kailangan talaga natin pag-isipan ng maayos kasi hindi lang isang bansa yung apektado dito. Napakarami. And then we compare whether a ban will actually be more efficient in terms of containing this disease or just making sure that the quarantine measures that we're imposing now on all ROFs will be a better system.
Dr. Ong-Lim, maraming salamat po.